Good morning, ladies and gentlemen. So today I would like to show our projects which are concerned with the analysis of the evening primrose extract as a potential anti-metastatic agents in the development of the solid tumor. So the project is employed by the interdisciplinary group of scientists from the Medical University of Lodz. Okay, I try to change the. Oh, probably here.
Or at the bottom, there is.
Okay, yes, it's working. So, as everybody well know, the cancer next to cardiovascular diseases are the second of the most often diagnosed disorders in the world, and is characterized by the very high mortality. So here I presented the data about the colon cancer because this cancer is the most important in our analysis, but we not only focus it on this one. So why the colon cancer? Because despite numerous studies, despite the prevention and the information campaign, it is still the third of the cancer which are diagnosed in men and five in men and fourth in the women. And this is the one of the three with the highest mortality rate. Only in the 2019, almost 56,000 people worldwide died of colon cancer, especially 28.5 men and 24.5 women. And it should be emphasized that the stage of neoplasms is important for the patient prognosis, because when the cancer is diagnosed in the first stage, in the in situ stage, that we observe almost 60%, 42% of survival during the next 5 years. And when it is diagnosed in the metastatic stage, in the fourth stage, it is only about 11. Of course, it is dependent of the statistics, because it is between the 8 to 14, but this is the mean value. It's about 11. What is the metastasis, and what is important in this? So during the metastasis, the cells change their character from the characteristic for the most of the cancers, epithelial one, to the mesenchymal. So then cells translocated, moved from the tumor and to the surrounding tissue or to the blood, and then translocated to the other organs. So in the colon cancer, it is usually three organs which specific when we observe the specific metastatic cancer. So this is the liver, the peritoneum, and the lung. We are interested in other two cancers. The lung cancer, this is the most common cancer in the human, when the statistic is the worst during the Olds tumor. And the malignant pleural mesothelioma. So this is not very popular cancer, but despite it is very often can arise from the mesenchymal cells, or it can translocate into them relatively quickly. So despite the low probability of the occurrence of the MPM, its mortality rate is relatively high. So our study are focused mainly are followed the recent trends of the phytomedicine and functional food. We are used the extract of the evening primrose, the Oenothera paradoxa. This is the plant which are grown in Poland, and it is very popular in Poland. And we obtain the seed which are used in the food industry from the produce the oil, which are applied in the, as the medicaments, diet supplements. But after the production, as the product, we can obtain the defatted seeds, which are characterized by the high content of the polyphenol and source of the unsaturated fatty acids. But in our study, we especially focused on this point of the high content of the polyphenols, because it can modulate the oxidative stress, the one of the most important element which can induce cancer development, cancer progression. And we try to analyze the role of polyphenols in the modulation of cancer, to use it later as the diet supplements or the potential medicaments in the future. Okay, here I will show the results of our study in the very short picture, because we observed two main things which we can modulate by the extract of the evening primrose, the fatted seeds. So first of all, we observed that in all tested cancer cells, because our study now is on the cells level, we observed the lower cell proliferation. But what is more important, we observed that cells lost their metastatic ability. What more, it's turned on, so the mesenchymal cells transitioned again to the epithelial one. So thanks that, we think that it is could be very useful for the chemotherapy, because then we can observe only in situ cancer. Okay, what are our future plans? So first of all, we would like to make the analysis of the animal model, and we obtain the grant from the incubator for 4.0, and we start this analysis next month of the mouse with the induced colon cancer. On the other way, we would like to analyze the role of the fraction of polyphenols, because in our very stable extract, we observe that the many flavonoids which could be work as the anti-metastatic agent. So we would like to confirm this supposition in the near future. So after the analysis of the animal models, we would like to start the validation, the EP, as the potential diet supplement. And we are thinking about the validation of the medical the medical potential of this extract. But of course, as everybody knows, it is a very, very long procedure. So this is in the longer future plans in our group. So, as I said at the beginning of the presentation, we are in the disciplinary group of the scientists. So we have the chemist, biotechnologist, and biologist. And this is the collaboration between two departments of the Medical University of Łódź. Thank you very much.
Thank you very much, Dr. Sobierajska. If anyone would like to ask a question, please feel free to type it in the chat box. On my side, I have a question. What is the current state of art when it comes to the impact of polyphenols on in vivo models and animal models? Because there must be some kind of data available, right?
Yes, we know, but our extract is the one of the first which will be tested. This type of extract will be tested of the animal models, because first of all, this is the extract of the fatted seeds. Yes, usually a lot of information which we can find in the literature data, it was from the oil extract, not from the fatted seeds. This is the first of all. Second one, only the flavonoids was tested in the animal model previously, but nobody analyzed the metastatic ability of this extract. So we would like to find that this ability, this modulation will be observed during the animal models analysis.
As I understand, the chemical ingredients of this extract, it's much differs a lot from the.
Yes, this is the much different than the oil extract and other extract. And to what is more important, this is very stable because we make the analysis during the 3 years, and we confirm the concentration and of the each polyphenols, and it's still stable.
No, that's great.
Yes, this is very great for pharmacy, in my opinion. Yes, and for the food industry.
Yes. Well, I can see that there are no questions, and your project is under construction. So
yes, we are at the beginning stage. So now we are trying to find some collaboration to the grants in the CBR. Yeah. Okay.
Are you looking for companies?
Yes, we are looking for companies now. Yeah.
Interesting. Well, definitely worth trying, and I wish you all the best. I don't wish you luck. I don't wish you luck because in science it's better to.
Thank you very much. Thank you.
All right. Thank you very much.